Being overweight or obese can have a range of negative consequences for both physical and mental health. It's important to note that the degree of these consequences can vary depending on the extent of obesity, genetics, overall lifestyle, and other factors. Here are some of the potential bad consequences of being too fat. Increased risk of chronic health conditions. Heart disease. Obesity is a significant risk factor for heart disease, including coronary artery disease, heart attacks, and congestive heart failure. Type 2 diabetes. Obesity is a leading cause of type 2 diabetes, which can lead to serious complications like nerve damage, kidney problems, and vision loss. High blood pressure. Obesity often leads to hypertension, high blood pressure, increasing the risk of stroke and heart disease. Certain cancers. Obesity is associated with an increased risk of several types of cancer, including breast, colon, kidney, and pancreatic cancer. Joint problems. Excess weight can put significant strain on the joints, leading to conditions like osteoarthritis, which can cause chronic pain and reduced mobility. Respiratory issues. Obesity can contribute to breathing difficulties, such as sleep apnea and asthma, which can lead to poor sleep quality and daytime fatigue. Gastrointestinal problems. Obesity is linked to conditions like gastroesophageal reflux disease, GERD, and gallstones. Increased risk of stroke. Obesity can increase the risk of stroke by contributing to the formation of blood clots and the narrowing of blood vessels. Fatty liver disease. Non-alcoholic fatty liver disease, NAFLD, is common in individuals with obesity and can lead to liver inflammation and, in some cases, liver cirrhosis. Psychological and emotional effects. Being overweight or obese can lead to a range of psychological and emotional challenges, including low self-esteem, depression, anxiety, and social isolation. Reduced quality of life. Obesity can limit physical activity and impair daily functioning, reducing overall quality of life. Decreased lifespan. Studies have shown that obesity is associated with a shorter lifespan due to the increased risk of chronic diseases. Financial costs. Obesity can lead to higher healthcare costs, including medical bills, prescription medications, and treatments for associated health issues. It's important to emphasize that obesity is a complex issue with multiple contributing factors, including genetics, diet, physical activity, and environmental influences. Managing obesity often requires a comprehensive and individualized approach that may include lifestyle changes, dietary modifications, exercise, and, in some cases, medical intervention or surgery. If you or someone you know is struggling with obesity, it's essential to seek guidance from healthcare professionals to address the associated health risks and develop a plan for sustainable weight management. Certainly, here are some additional consequences and considerations related to obesity. Reproductive health issues. Obesity can lead to hormonal imbalances in both men and women, affecting fertility. Pregnant women who are obese are at a higher risk of complications during pregnancy and childbirth, such as gestational diabetes and preeclampsia. Increased risk of metabolic syndrome. Metabolic syndrome is a cluster of conditions, including high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. Obesity is a significant risk factor for metabolic syndrome. Obesity can lead to skin problems, such as chafing and skin infections in the folds of the skin. Stretch marks and skin discoloration may also occur. Social stigma and discrimination. People who are overweight or obese often face social stigma and discrimination, which can lead to mental health issues, such as depression and anxiety. Difficulty with mobility and activities of daily living. Obesity can make it challenging to perform everyday tasks and lead an active lifestyle, which can further exacerbate weight-related health problems. Childhood obesity can have lifelong health consequences, and obese children are more likely to become obese adults. Individuals who are obese may encounter challenges in accessing appropriate healthcare, as certain medical tests, treatments, and medications may be less effective or harder to administer. Nutrition and food choices. Obesity can be associated with poor dietary choices, which can lead to deficiencies in essential nutrients. Sleep disturbances like sleep apnea are more common in obese individuals, which can affect overall well-being and cognitive function. Impact on the healthcare system. The healthcare system bears a significant burden due to obesity-related healthcare costs and the increased demand for medical services. It's important to approach discussions about weight and obesity with sensitivity and empathy, as individuals may have complex and personal experiences related to their weight. A supportive and non-judgmental approach is often more effective in helping individuals address their weight-related health concerns and make positive changes in their lives. Consulting with healthcare professionals, including registered dietitians and therapists, can be valuable in developing a holistic approach to managing obesity.